I'm Lisa Yen, and I wanted to share with you some tips and tricks that we've learned about managing chemotherapy side effects and things that we might encounter when having to go through chemotherapy. That's become part of our journey recently, and some of these things we've learned because they were gifts from other people or advice from a nurse or provider. And so I thought I would share some of this with you. So now remember, not all chemotherapy is the same and not all people are the same. So not everyone has the same experience. And this is not in any way meant to be prescriptive, telling you what to do or an exhaustive list of things that you might experience or even saying that you will experience these things. And please don't feel like you have to go out and buy these things, but just consider that maybe some of these tips or tricks might be helpful for you as you consider your own journey as well. So I'm going to start with some of the things that may not even be related to chemotherapy, but if you have a port, some of the things that might be useful for you. And a port is something that is placed in the chest that allows nurses to access blood or to give infusions of, say, a chemotherapy that might be really irritating to the veins. And so if you need that, then you might have a port placed. And in order for a nurse to be able to access the port, you might need a special shirt. So the nurses might tell you to wear a V-neck, but even better was this gift that was given to us. And this shirt, it looks like a regular t-shirt, but this is really nice because there's buttons along the top, kind of like a hospital gown. And so the button allows easy access. You can open it up and access the port, and then you can close it up again for privacy and for comfort. And it looks perfectly normal, not like you're wearing a gown or anything. So that's been really convenient. And then there's this other little thing, and not everyone needs this. And there's something you can buy like this on Amazon, but there was a lady at the infusion center that happened to make this. And now, if you think about it, when you sit in a car, if you have a port on the right side of your chest and you're on the passenger side, the seatbelt might rub against your chest. Or if you have a port on the left side and you're in the driver's side, again, the seatbelt might rub into your chest. So this is a little thingy, like it looks like a little pillow, and it has a little Velcro that you can strap on the seatbelt, and then the pillow lays up against your chest, so there isn't any rubbing against the port or any pressure against it. It makes it nice and comfortable. But again, not everyone needs it, but it's a cute little thing. It's something you might be able to do on your own or have a makeshift little thing, or just put a little pad or towel there. Another thing, and now this is a prescription thing, but it is something that the nurses advise us to ask for a prescription for, and something that our doctor did prescribe is a numbing cream. And this is a numbing cream made out of two different numbing medications, lidocaine and prilocaine. And it's a cream, again, prescription, that you can put on the port site before they need to put a needle in it to make it a little bit more comfortable. So those are the things that relate to a port and whether or not you have chemotherapy. Some people do have ports for other reasons, and that's been useful for us. Now, other things that we learned is that with certain medications, including some chemotherapies, you get a little bit more sensitive to sunlight. And this is more than normal. So a good reminder, as always, to put on sunscreen and something with SPF at least 30, your favorite sunscreen. And when you put on sunscreen, to also remember your lips can get chapped. So again, something with SPF 30, and this one I like is Aquaphor, and it has SPF 30. When putting on sunscreen and protectants for your skin, remembering that there's other things you can do, like wear a hat. Something with a wide brim like this could work well for you. And in my culture, we like to use umbrellas, which also blocks the shade. And some umbrellas have SPF, but it's not necessary. You can just have something that blocks the sunlight. So those are the things to help with sun protection. Now, another thing that can happen is that you can have dry hands and feet, or uncomfortable hands and feet called hand-foot syndrome. And one thing that we were advised to do to protect that is to put some cream or ointment, some really more thicker, heavier base cream or ointment on your hands and feet. So here's an example of Aquaphor, which is Vaseline base, and it's a healing ointment. And then here's a shea butter. And it's something that you can put on your feet and then put socks over it before you go to bed, and that kind of helps lock in the moisture. Another thing that we were told that you can experience is a metallic taste in your mouth. So what can help with that is simple things like not using metal utensils. So here's an example of like bamboo chopsticks, but other things like lozenges. So this is an example, peppermint lozenges, and that might help. With dry mouth, there are things that you can either rinse your mouth with, biotin, which is an oral rinse that can help with dry mouth, or ACT, dry mouth lozenges. And that can soothe and moisturize your dry mouth. That can prevent cracking as well. Big thing that is often encountered with chemotherapy medications and other medications is nausea. So our first line of attack is medications, prescription medications. And the doctor did prescribe several medications, and this is, again, not necessary for everyone, but the ones he prescribed for my husband, is one called ondansetron or Zofran. Second line is compazine. And the third one is used off-label. It's olanzapine, which can be taken at bedtime. And that's the off-label use is for nausea. And it seems like there's been a lot of advances in managing nausea, and that's really helpful to make people more comfortable. There's some non-medical things that you can do, like use lemon ginger lozenges, and this also tastes good, so it can help, and it can help with the metallic taste in your mouth. Some people like other non-prescription things like an herbal inhaler. This is called All Clear, and it's something that you can either sniff or rub, and that might be soothing for nausea. There's also these C-bands, and some people use this when they're on a boat or go on a cruise. And it's a band that you wear on your wrist, and it provides a little pressure on certain pressure points that might help with nausea as well. We were also warned that there can be diarrhea, so to make sure that you hydrate really well, maybe take some electrolytes. So we definitely have electrolyte replacement in the form of packets. There's brands like Pedialyte, Drip Drop that you can just have little packets and you can mix in your water. And then also have over-the-counter medication like Imodium on hand, just to make sure that you take that in case there's diarrhea. We're also told to take some vitamin D as well. And then other things that can be helpful for comfort. There are things that can happen like cold sensitivity. So things like gloves might be helpful, and then gloves if you're maybe handling cold things. These particular gloves were gifted to us to relieve tension and stress, to just provide some heat and comfort, and they're just kind of cool. So that is just fun. And other comfort things like essential oils might be comforting, a diffuser, And then another comforting thing is just a blanket, because again, you might get cold. This blanket is really special because it has some inspiring words. So not just is it help with cold, but it can be really inspiring and comforting knowing that people care. And here's another really fuzzy fleece blanket that can also help with cold and comfort. I also like little mementos. There's some worry stones. This one says 1 day at a time, something that you could hold in your hand and maybe feel to help you feel grounded, or a little memento like this, something meaningful that you can hold on to, whether during the treatment or during a time of stress, during a scan, something like that. So those are our little tips and tricks. I hope that this helps you. And one other thing I'm going to add is sometimes people think of hair loss. It wasn't something we were encountering with this type of chemotherapy, and it's not anything that I have a tip or trick for today. And again, not all chemotherapy causes hair loss, nor does it cause all of these things, but there are definitely other things that can be done for that. So I hope this helps you. And if you have additional tips and tricks, feel free to share it with us as well. Thank you.